Good morning, Victoria, Derbyshire with you on 5 Live. It's 18 minutes past 10. Government plans to change disability living allowance, which is the benefit paid to sick and disabled people who need extra help with mobility and living costs, will be challenged again in the House of Lords later. A group of crossbench peers is demanding a review of the changes. The government says more than £600 million a year is paid out to people in disability living allowance when they're no longer entitled to it. In the last few weeks, we've had a big response on this programme to this issue, and there's a lot of passion, sometimes propaganda, sometimes spin on either side when it comes to the facts here. So let's begin with our political reporter, Chris Mason, who hopefully can give us the facts about what the government is planning, why, and what effects those changes will have. So go through each of the various bits of the current proposals to change from disability living allowance to personal independence payments.
Yeah, the big picture here, Victoria, is that, as we all know, the government says it wants to save a lot of money, and the welfare budget is the biggest slice of government expenditure by a mile. About £1 in every 4 that the government spends goes on welfare payments. So there's big reforms coming across the welfare state, and specifically on the issue of disability living allowance. This is a benefit that's been around for the best part of 20 years. It was introduced in 1992, the idea being to help disabled people cope with the extra costs that they face in their daily lives. So it's over and above anything connected to work. You can receive the benefit whether you're working or not. The government's position is that the benefit is complicated, it's inconsistent, it needs to be simplified, and there hasn't been a sufficient review of those people on it for a long time. And so that's their motivation for this change to a different allowance that would be called the personal independence payment. Now, the idea is, at the moment, about 3 million people get disability living allowance, costs £12 billion a year. To put that cost, 12 billion sounds an incomprehensible sum, doesn't it, really? To put that cost into some perspective, the whole talk last week about High Speed 2, the high-speed rail link between London, Birmingham onto Leeds and Manchester, would cost 33 billion. So about a third of the cost of that every year going on this particular benefit. The government reckons it could save about 20% by switching from the disability living allowance to the personal independence payments. Many disability campaigners say it would hit the most vulnerable the hardest and strikes right to the heart of what a welfare state's all about.
So the government says it could save about 20% of that 12 billion bill each year by clearly taking some people off the disability living allowance. So how will it do that?
Yeah, that's ultimately what they would be doing. They have some dispute over that 20% figure. Maria Miller, who's the Minister for Disabled People, says it isn't so much a 20% cut as ensuring in the future that the scale of increase is reined back, because they project that if they were to leave the system unchanged, then it would be on a rise, if you like, and over time, by switching to this new system, you would have a 20% cut on where you would have otherwise been. Fundamentally, at the heart of what they say they want to do is to reassess those people who receive the benefit right now to try and determine whether all of them actually need it. The idea being, they argue, that people's disabilities change over time, and if there's been a long period since they were originally assessed, then the data upon which they're handing their money out, if you like, might be inaccurate.
Okay. And once that reassessment has taken place, then how regularly would those reassessments be?
This is still something that is very much up for debate. In fact, some of the amendments being put forward in the House of Lords this afternoon, when it's debated around about 4 o'clock this afternoon, are debating this exact point, at what point you would have reassessment and over what period you would have a lag, if you like, between an assessment and some money being handed out. There is clearly within government a recognition of how dangerous potentially this is for them. Very critical pieces, for instance, in some newspapers that are normally very supportive of the coalition. It's not for any other reason. The whole issue of social security is often known as the third rail of politics. Touch it and you can be done for as a government. There's a real consciousness of that. Only last week we saw some movement, some effective U-turns really, as a result of defeats in the House of Lords on the broader package of shaking up the welfare system, and there will be a hope from campaigners that there might be more to come. Already a hint from Lord Freud, who was a welfare reform minister for the government in the House of Lords, that he's going to back some of these amendments coming along this afternoon, which might mean there is some movement, if not as much as some campaigners would like.
OK. Chris, thank you. Chris Mason, Five Live's political reporter. Let's speak, first of all, now to Baroness Tanni Grey-Thompson before we hear from some people who are at the moment receiving disability living allowance. And Tanni Grey-Thompson, you will be speaking about this in the Lords later. As far as Chris Mason's summary is concerned, do you agree with those points? Because we do want to concentrate on the facts today.
Yes, I do, and there's no doubt that this system does need reform. I don't think anyone's arguing against the need for reform, but some figures that the government released yesterday suggested that 500,000 disabled people would be removed from DLA, and DLA is an important benefit for people because it papers over the cracks, whether that's in the National Health Service or in social care budgets, and it really supports a huge number of disabled people. And my real fear is that without it, disabled people will be ghettoised, they'll be pushed away from society. A number of disabled people will find it very difficult to stay in work. And it'd be fantastic if we didn't have to have this benefit. But the reality is that public transport is not terribly accessible. There's a lot of discrimination against disabled people getting into the working environment. And this benefit is desperately needed by an awful lot of people.
We'll talk specifically about what DLA is spent on in a second, but you said the government believes they'll remove about 500,000 people from the DLA. Perhaps those are people whose condition has changed and improved, and therefore they don't need it anymore.
Well, it might be, but we don't actually know that. And one of the things we're discussing this afternoon is asking for an independent review before the new PIP is implemented. And I think that's quite important because you can have things written on paper and you can have as many models as you want, but I need convincing that actually it's not going to be a massive detrimental effect to disabled people. And without an independent review, I'm just not convinced that's the case.
For an individual, what can the disability living allowance benefit range from and to? From £70 a week up to what sort of value are we talking?
I think it's into about £120 a week.
And what is that money spent on?
Well, the thing with DLA is it can be used however the individual wants to use it. So I receive DLA. I use it because of extra costs of transport. I've used it to make my house wheelchair accessible, because actually to buy an accessible house is incredible, or to rent an accessible house is incredibly expensive, or to have a bungalow is expensive. People use it for all sorts of things, and just in the last day, I think my final count on emails to this morning is I've had about 350 emails from disabled people saying that they use it for massage, which is not provided, for in the community, which helps them with pain relief, which means they take less medication, which obviously saves the National Health Service money. It's used in many different ways. A lot of disabled people are in low-paid work, and because public transport's not accessible, they do use it to help with a car to get to and from work. So it's used in many different ways, and that's where I think the advantage is with DLA. Is that it's up to the disabled person how they use it. They make their choice. And that's really important, that disabled people are allowed to choose, because they have to be integrated in society. I don't want to go back to how it was when I was 7 and 8 years old, when I first became a wheelchair user, where I didn't meet another disabled person because they weren't out. They were locked away from society. And we can't go back to that.
In terms of this desire for an independent review, what are the figures like when you look around at your fellow peers? Are the numbers stacking up in order to achieve that or not?
The numbers are looking good right now. It all comes down to the quality of the debate and the speeches, because I think there are still a number of people who are wavering. And it's not just in terms of how people vote, it's whether we can encourage, a sizable number of people to possibly abstain from the vote. I think there's a lot of passion in this house for disabled people. There's a lot of support. And yes, we are in tough economic times. There's no doubt about that. But the fear for me, again, is that if we remove this benefit from disabled people without thinking about it very clearly, we could actually be pushing them into having much higher support costs 2 or 3 years down the line. So we might save a bit of money now, but actually 5 years we could have a much heftier bill.
Do you agree with the principle of regular reassessments, or do you think once you receive this benefit you should get it for life, which is what the government says is the situation at the moment?
I think some people should receive it for life, and some people will have either a fluctuating condition or a condition that might change or improve. My husband had a spinal cord injury at 20, and for the first 2 years he couldn't walk, and then over about another sort of 3 years after that, he gradually, was able to walk and move around. So there has to be a cut-off point. But what is terrifying for a number of disabled people when they have a fairly serious level of impairment, their condition's not changing, and then being forced to go through review process after review. And one of the other things...
But once a year, I mean, is that such a stressful situation?
Yeah, once a year is, because the assessment will often be carried out by different people. There can be a question mark on the level of training of the assessor. There can be sort of a differentiation in how that assessment's reported. So once a year, and actually there's a significant cost to testing disabled people once a year. So, I think some people should probably be tested every 5 years. But also one of the things we're arguing for this afternoon is saying that it's really important that disabled people's medical evidence is used. So if there is medical evidence, which either their consultant or their GP has, use that as part of the process as well. Don't keep recreating the wheel. Don't keep spending money on assessment processes that aren't needed. And I think we have to have a much more detailed discussion about that to ensure that the assessment process is right, because we've seen it in other parts of assessment processes, whether it's for sort of work capability. There's a massive overturn rate. There's a massive number of appeals which get overturned, and that must mean that there's a problem in the system. So I don't particularly have a problem with disabled people being assessed, but let's not do it more than we have to, and let's not waste money doing it.
Thank you for your time. Again, Baroness Tanni Grey-Thompson, who'll be speaking about this in the Lords later. After the news and sport, we'll hear from Kaliya, Frankilin, from Jane Young and from Louise, Bolotin, who all receive disability living allowance, and we'll hear what they make of the changes. Thank you very much. It's 10:37. It's 5 Live. Good morning. We're going to hear from Kaliya, Frankilin, who is one of the authors of a report into this particular disability living allowance reform. The report's called Responsible Reform. It's come to be known as the Spartacus Report. Kaliya is also a disability rights campaigner who receives disability living allowance. Good morning, Kaliya.
Good morning, Victoria.
Jane Young is with us, a wheelchair user from London. Jane, hello to you.
Hello.
Thank you for your patience, and as well to Louise Bolotin, who is from Manchester. Louise has epilepsy. Louise, hello. Thank you for your patience.
Hello.
And we have the Minister for Disabled People with us, Maria Miller. Good morning.
Good morning.
Tell us what you think of this idea from a number of different peers in the House of Lords of an independent review of your planned changes.
Well, obviously, first and foremost, what I want to say today is that we have committed, we're absolutely committed to ensuring that the sport is there for disabled people, and that's why we're continuing to spend £40 billion a year supporting disabled people with services and benefits. And we will be continuing to look particularly at the new personal independence payment as it moves forward, making sure that we're getting it right, making sure that we are doing the right research and continuing to work with disabled people in their organisations. And I think because of all of that, we will be making sure that the benefit is working as it should do, which is to make sure the support is getting to where it's needed, and that taxpayers can be absolutely confident that the money is being used as it should be. And at the moment, we know that £600 million is going out every year with regards to DLA to people whose conditions have improved.
How do you know that?
It was actually research that was done under the last administration, and it shows not only that £600 million is going out to people whose conditions have improved, and there's no inbuilt way of reassessing under DLA, and so people are continuing to receive this money who no longer have the conditions that would give them that access to that benefit. But even more concerningly, there are many people out there who are not receiving the support that they should, again, because their condition has deteriorated, and that hasn't been picked up either. You know, this benefit is out of date, it's past its sell-by date, and it needs replacing.
And so the idea of an independent review, would you back that?
Well, we already have built into our legislation the idea or the fact that we will put in place a review once the personal independence payment is in place. It's something that will be debated again in the Lords today. But what we have to do is to get on with putting in place the new personal independence payment, because we have to act now to stop the overpayments that are happening, which not only are wasting taxpayers' money, but also undermining the credibility of this vital benefit to support disabled people.
The problem that I'm picking up from listeners who've got in touch with us about these planned changes over the last few weeks is that they simply don't trust your government to do the right thing for those who do need the support.
Well, what we hear from people is that they absolutely understand the importance of putting the right support in place for disabled people. And as I said, that's why we're continuing to spend £40 billion across government. But what
it's
taxpayers
a trust issue. It's a trust issue.
But what taxpayers want is to make sure that the money is actually going where it's needed most. And I think the trust problem at the moment we have is that all too often people know that our benefit system is not working in the way that it should, and particularly when it comes to DLA. The fact that £600 million is going out in overpayments is something that causes great concern. And the reason for that is that 70% of DLA claims are basically people who are on the benefit for life, and that conditions change, and that is not picked up. And that is something that with the personal independence payment we will change. And I think people welcome that change. Organisations like Scope have acknowledged the need for a change to DLA, and even the leader of the opposition himself has said that he welcomes the idea of a gateway into this benefit. So there is support for that change.
Kaliya, Franklin, do you support regular reassessments so that people who at the moment are on DLA for life will have an interview, will have a face-to-face assessment once a year?
I think it very much depends on the situation, and I think that the Minister is being somewhat disingenuous to suggest that there isn't a reassessment process. For example, in my own situation, I first applied for DLA in about 2000, and I received an award of lower rate care for a year, which was absolutely appropriate to my needs at the time. But my condition has gradually and sadly deteriorated very much over the years. So now my most recent DLA award last year was for higher rates of care and mobility on an indefinite basis. But it didn't jump straight from lower rate care to higher rate care. I've gone through periods of time of receiving different awards which reflect that my condition has gradually deteriorated, and it was only because I was able to supply overwhelming medical evidence from my GP, from multiple consultants, from a carer, from my physiotherapist, that I did finally receive the higher rate awards.
And so you're worried that some people won't be able to do that as thoroughly as you have?
Absolutely. I mean, I have a law degree, and it's extremely difficult and distressing to fill out a disability living allowance form. But the reason that it's distressing is because it's the only time in an individual's life that you have to reflect purely on all the things in life that you can't do. And that won't change with the personal independence payment. And I'd particularly like to say that as one of the authors of the Responsible Reform report, we absolutely support reform to the disability living allowance. There are changes that can be made which could save money and improve the way that the benefit works. But what we don't believe is that it's necessary to introduce an altogether new benefit which has been predicated on the assumption of finding savings of 20% up until 2015.
Maria Miller, do you want to respond to those points from Kaliya?
Well, I think the points Kaliya raised are very much what other people have raised with me as well, that the idea of a self-completion questionnaire that is very negative, is talking about what people can't do, is the way that DLA applications are made at the moment. We want to change that, and with the personal independence payment, it will be a face-to-face conversation with a health professional who will be able to support that individual, not just to make the right claim, but actually actually, hopefully, to identify, the real problems an individual faces. So I actually think that Kaliya would be seeing the right level of support through the personal independence payments, where perhaps in the past, under DLA, people have been, frankly, left to do it themselves. But can I just pick up on the point of savings? It's not right to say that we will be making cuts of 20% to the budget. What we're trying to do in these difficult economic times is to keep the rate of growth of DLA, or in the future PIP, more under control. So in fact, we'll be spending in the future the same as we were last year on DLA, so some £12 billion. It will continue to be the largest benefit that supports disabled people.
Could I come back and answer that, please?
Please.
It is an effective cut because it's basing it on the current figures and it takes no account of demographic changes. One of the things that we particularly considered in responsible reform was what had happened to the caseload for disability living allowance over the past 10 years or so. And what we found was that actually for people with physical disabilities, the growth in caseload is entirely accounted for by demographic change. It's only an increase of about 350,000. Where the growth has been significant is for people with learning disabilities and mental health problems. And one of the reasons that we think there should be an independent review before PIP is introduced is to investigate why this is happening. Now, we know for people with learning disabilities that this was always the intention of DLA. It was introduced in 1992 and it was expected to grow because it was to provide support in the community for people who had previously been condemned to institutional living. And the growth in mental health conditions isn't linked specifically to the UK or benefit rates. It's part of a worldwide trend of increasing mental health problems. And we feel that that should be addressed independently before a new benefit, which is based very similarly around the model of the failing employment and support allowance benefit, is introduced. The WCA is widely regarded to have been very problematic, to be generous about it, and the government have committed to continuing with Professor Harrington's review of it. Now, to base an entirely new benefit, which was only trialled on 900 people, one of whom was a deaf-blind lady who contacted us to say that despite repeated attempts with G4S who ran the PIP trial, that they had not been able to supply a translator. So in the end, they simply did not assess her. Now, if PIP is in such a state that during a small-scale, limited trial, it's not capable of assessing those with very complex support needs, then we think that it is perfectly reasonable to ask for a pause in this reform until all these problems have been ironed out.
Maria Miller, there was a pause regarding Andrew Lansley's NHS reforms. Why not a pause here?
Well, first, can I pick up on a couple of the points that have been made, because I think it's really important that people understand that there has been a 30% increase in DLA over the last 8 years, and that most of that increase is not due to demographics, and that's the analysis that we have done, very rigorous analysis.
What's it due to then?
Well, it's due to many things, including the widening of the gateway and an increasing amount of case law because of the fact that the assessment is not working in a robust enough way. And I think the other thing that's been raised in terms of assessing people with complex needs, the trial that we did in the summer was not about the method of assessment, it was about the assessment criteria themselves. And obviously when we come to this actually being put in place, the fact that we are having face-to-face assessments will absolutely help people who have the most complex needs, whereas at the moment we simply leave them with a self-completion questionnaire. That can't be right.
Before you go, Maria Miller, and thank you for talking to our listeners, Louise, I know you want to ask Ms Miller about gateway benefits.
Yes. Is the Minister aware that receipt of DLA actually enables people to claim what are called gateway benefits, for example, disabled rail card and bus concession passes? You normally have to be able to prove that you're in receipt of DLA for those. So I'm really, really concerned that those people that don't become eligible for PIP when the transfer is made, that they will lose those additional benefits. For example, with my epilepsy, I'm not allowed to drive because my attacks occur without warning, and they're not completely controlled even with medication. So my DLA goes towards paying for taxis, but I'm also dependent on public transport to get around, and I really, really need those gateway benefits such as disabled rail card and a concession bus pass in order to be able to get around, because I can't just jump in a car and go like most people. So is the Minister aware that these will be other changes that will severely affect people if they lose their entitlement?
And what I'd say in response is people who need support based on the assessment will get that.
So they'll continue, if they get the new personal independence payments, they will continue to get help with rail cards and so on?
Yes, well, I think the first thing to say is that the research that we published yesterday has got a number of case studies in it so that people can really understand how it will work and how it will support people. And to reassure that in terms of what we call passported benefits, we're working across government already to make sure that these really important passported benefits are there for people who continue to need them.
So somebody like Louise, obviously, we don't know the details, but Louise has epilepsy, cannot drive. She would continue to get gateway benefits.
Well, what we're making sure is that the way that other departments, such as the Department for Transport and local authorities, how they use DLA at the moment as a way of identifying people who need extra support, we're already working with those organisations to make sure that there is a clear way forward and that people who need that help continue to receive it in the future.
Can I reply to that?
Please.
Because I have seen the PIP case studies myself this morning, and I particularly looked at those case studies that were included that concern epilepsy, and I don't think that I would qualify for PIP under those particular case studies. It's based on a points system. I handed my driving licence in 15 years ago, and I have never reached a period of 12 months since then which would enable me to reapply for my driving licence, and I'm resigned to the fact that I will probably never drive again. But if I don't qualify under the PIP point system, which I'm fairly sure I won't, then I will lose that passport benefit. I will lose the opportunity to have reduced cost travel because I will not be able to drive again.
Well, the way we will identify people who need support will be through the assessment. This is very much what disability organisations have asked us to do, rather than identifying people by their condition. So it's a matter of looking at who actually needs extra help and extra support through that assessment, and they will receive that support. It's very difficult for me to talk about an individual's case in that way, but I would say that one of the reasons why we're continuing with a further consultation is that individuals can come forward with their thoughts on how the assessment would work, and so we'd welcome that further input so that we can make sure that we really do get this right.
Just to be clear though, you're saying no to any pause?
Well, what we're doing already for the past year and a half is working with disabled people and disabled people's organisations. We're going through a further round of consultation now. We actually did some very extensive research in the summer about the assessment criteria, and we will be carefully introducing this new benefit to replace DLA to fully test it before it is used to reassess individuals who are currently receiving DLA.
Okay.
We're talking about the autumn of next year that this is going to be working for individuals who are currently receiving DLA for them to reapply. That will be a 6-month initial sort of testing period. We want to make sure that this is right, and we'll continue to make those changes that are needed to ensure that it is right.
Thank you for your time, Maria Miller. Maria Miller is the Minister for Disabled People. Louise, Kaliya and Jane. Jane, I'm aware you haven't spoken yet, so we're just going to take some travel news and they will be back with you immediately, if that's all right. Here's Michelle. So Jane, Kaliya and Louise are still with us. Jane, having heard Maria Miller, the Minister for Disabled People, what do you think? Are you reassured in any way?
I'm not reassured at all. Like Louise, I've been looking at the case studies and the thresholds for the different levels of the daily living and the mobility components of the new benefit. And I just explained that I use a powered wheelchair when I'm out and about, but I don't use a wheelchair at home. Just last week I took delivery of a specialist wheelchair accessible vehicle that I can drive my wheelchair into, and transfer into the driving seat to drive myself, which will give me independence for the first time in several months. But I look on these case studies and I find that there's a chap in case study 6 who he can't walk more than 20 to 30 steps, but he still doesn't gain enough points under the criteria to get the enhanced mobility component, so he wouldn't be able to get any kind of specialist vehicle or even a normal car under the Motability scheme, and so I'm thinking that mine will have to go back.
So you will be able to get some benefit under the mobility part of the new PIP, but not as enough to enable you to get a vehicle like that.
That's right, and what will happen is that under the mobility rules, as soon as I'm denied benefit, my car will be repossessed, even if I plan to appeal, and adapted vehicles like that, which have a lowered floor and a ramp that automatically comes out, cost at least £40,000, and I will have to try and find £40,000 if I want to go out and about.
Or somebody might say, well, you could get a taxi. Yes, the car goes back. You could get taxis.
I could, but what happens if I want to go and stay with somebody? My powered wheelchair won't go in just anybody's car because it's far too heavy and far too bulky. It needs at least a hoist, if not a vehicle that I can drive it into. You wouldn't want to get a taxi to go and stay with relatives who live in Norfolk or somewhere from southwest London. That's ludicrous, incredibly expensive.
Well, from what Maria, let me ask all of you this. From what Maria, we're coming up to the news as well. I've just looked at the clock. What Maria said, from what Maria Miller said to us, at this point, it doesn't look like there's going to be any pause. Certainly, depending on the vote later, the government isn't inclined to go for this independent review because, as she said, they're reviewing it the whole time that they're moving forward with it. So what do you do next?
I received quite a disturbing email from Enable Scotland yesterday, which was a copy of an email they'd received from the DWP about the consultation into the PIP assessment criteria. Now, they were representing an organisation of people with learning disabilities, and so they asked for an easy read version of the consultation. And I can read from the email to you, which says, "We will be providing several alternative formats for these documents. However, we will not be producing an easy read version." And they go on to justify the lack of an easy read version because they say it's essential that the reader understands the proposals. Now, easy read versions are widely used, not just in learning disabilities, because what they do is that they concentrate down to the exact issues. And it's extremely disturbing that a group representing learning disabilities have been told by the Department of Work and Pensions that they cannot have an easy read version of these criteria because their clients might not understand it. These are absolutely the most vulnerable people in society, and their views are being ignored.
Thank you very much for your time today, Kaliya Frankilin, Jane Young and Louise Bolotin. You heard also from Maria Miller, the Minister for Disabled People, and from Dame Tanni Grey-Thompson, who will be pushing in the Lords today to have an independent review of the government's proposed changes to disability living allowance. Your views welcome. I have got some emails. I'll try and read them in the next hour. The news is next here on 5 Live. It's coming up to 11 o'clock.